Hi, I'm Chad Thompson, a pharmacist here in Anderson Township. Thanks for joining me. Today, I would like to talk to you about hormone replacement therapy. In recent years, there's been great discussion and many studies looking at the benefits and risks of hormone replacement therapy. I would like to take the opportunity to discuss with the community one such study, known as the Women's Health Initiative. I'll review the results of this study, how it currently affects hormone replacement therapy, and what effect it may have on the future of women's health. The Women's Health Initiative, it was very important because it was the largest study ever conducted looking at hormone replacement therapy. In fact, the study recruited almost 162,000 women. The objective of the study was to assess the benefits and risks of the most commonly prescribed hormone replacement in the United States. Half of these women were given a combination product of conjugated estrogen and medroxyprogesterone, better known as Prempro. However, due to adverse effects that happened during the course of the study was stopped short, just over 5 years, even though it was scheduled for almost 8.5 years. They had hoped to see some benefits of hormone replacement therapy in women, but instead they saw many of the risks that occurred from using this specific hormone replacement therapy. These risks included an increased risk of breast cancer by 26%. Not only that, but it showed an increased risk of heart disease by 29%. It also showed an increased risk of stroke by 41%, and it showed an increased risk of a pulmonary embolus or a clot in the lung by almost 213%. Additionally, it showed an increased risk of Alzheimer's in women by 200%. Due to the severe adverse effects that occurred during the study, 42% of the women were not able to complete the study. After the completion of the Women's Health Initiative, many smaller studies were also conducted looking at the risks associated with hormone replacement therapy. Some studies looking at the stroke risk showed that actually using estrogen alone improved women's cholesterol. It decreased their total cholesterol and decreased their bad cholesterol, known as LDL. It also increased their good cholesterol, known as HDL. However, whenever they added a synthetic progestin to this estrogen, it negated these positive effects that estrogen caused. Additionally, further studies were done looking at transdermal estrogen, an estrogen that people can get through a patch or through a cream. And these studies showed that transdermal estrogen had less heart risks than oral estrogen, an estrogen that you can take through a capsule or a tablet. More studies were done looking at these risks. The risk they looked at next was breast cancer. The first thing they showed was that estrogen alone, or unopposed estrogen, actually caused breast cancer to grow. Not only that, but the synthetic progestins stimulated breast cancer growth. However, whenever they looked at the natural progesterone that the woman's body produces, it actually showed to prevent breast cancer growth. So, many people say, you've given me these studies, but what do they mean? How do I interpret these results? Well, the first thing, the Women's Health Initiative actually laid the rest of the idea that horse estrogen or Premarin and or Provera were appropriate for use in menopausal women. With this information though, many women completely stopped their hormone replacement therapy altogether, and this allowed them to suffer needlessly. So people say, well, if you're saying I shouldn't stop my hormone replacement therapy altogether, what should I do? Well, why not let us look at the natural hormone cascade in women, what naturally occurs in women. Now, the closest I can get to the perfect woman, I would have to say, is my wife. However, even in her, I know this does not happen ideally. In this diagram, there are many complicated words and hormones. However, the important issue is there are 3 main hormones that women use. First, there is progesterone. Then there is testosterone. And then there are 3 active estrogens in women. Those are estrone, estriol, and estradiol. But there are 2 things you will not see in this diagram. Nowhere in this diagram will you find the words Premarin or Provera. So why are we using these to replace the hormones in the woman's body? Now, for those of you just joining us, I have reviewed some of the benefits and risks of hormone replacement therapy. Now I'll continue on to discuss how the hormones actually work in women. First, I will discuss estrogen. In women, there are 3 main biologically active forms of estrogen. Those are, as discussed before, estrone, which is mainly how women store estrogen. There is also estradiol, which is the main active form of estrogen in women that leads to both symptoms and benefits. The third estrogen is estriol, which is the weakest of the 3 estrogens, but in recent studies it has been shown to possibly be the safest of all the estrogens. Now I've told you what happens naturally in women. Now I'll discuss what is in conjugated estrogens, or in the synthetic forms of Premarin or Senestin. In these 2 products, they actually contain a complex extract of pregnant mare's urine. That is correct, I said pregnant mare's urine, therefore the term Premarin, that they use for hormone replacement. In these, they have 10 biologically active forms of estrogen, none of which are the 3 active forms of estrogen that naturally occur in women. In fact, these replacement therapies have to go metabolism in the liver to get an active form. Unfortunately, when it passes through the liver, in the woman's body it creates a known mutagen. That is, it creates a cancer-causing agent known as 4-hydroxyequilin. Now the term itself, 4-hydroxyequilin, is not important, but the fact that it is known to cause cancer is. Now I know when you look at your family tree and I look at mine, I don't have any horses. So why should we take hormones that come from horses to treat any symptoms in the body? Now I've discussed estrogen. Now I'll discuss one of the unknown hormones, or the seldom looked at hormones in the woman's body. That is progesterone. The first thing I want to point out about progesterone is not Provera. Now this is kind of the second chemistry lesson you'll have of the day, but I'll try not to get too complex. The molecule on your left, you will see, is progesterone. If you notice, it is not the same molecule that is on the right, which is Provera. There are 2 things that a drug company has added to Provera. The reason they add these items is a company cannot patent a naturally producing product. Therefore, to get a patent on a product, they have to tweak it just a little bit. When they came out with Provera, they added these 2 chemical entities. But when they added these 2 chemical entities, they did not get the same response that the body sees with progesterone.